Hello, everyone, and thank you for joining the Scleroderma Foundation's Virtual University Fall Series. Today's event will be a special panel event titled Connecting as a Young Adult with Scleroderma. My name is Angel Soto, and I'm the Programs and Services Associate for the Scleroderma Foundation's National Office and one of many organizers here today. Before we get started, I wanted to share some quick notes on today's event. If you're properly logged into this webinar, you should be seeing the 5 panelists on your screen and hearing my voice. If you've dialed into this event via phone, please turn down your computer microphone as to avoid any feedback. And for those of you that are using handheld devices such as phones or tablets, please note that you may have to swipe left or right to view different panelists. Today's webinar is being recorded and will be made available after the broadcast, so no worries if you jump in a little late. We encourage all of our attendees to use the question and chat feature opportunity, and at the end of today's segment, we will be taking these questions and answer segment. So let's get started. Our moderator today is Amy Gietzen from Buffalo, New York. Amy is 38 years old and is both a scleroderma patient and advocate, focusing on her mission of raising awareness of scleroderma. Amy's diagnosis came at the early age of 19. Her journey was followed by many frustrating twists and turns, disinformation, and uninformed healthcare providers. Amy, realizing her needs and the needs of other young adults with scleroderma may be different from those of older patients, started her on her journey of advocating for youth and young adults. She's traveled to various colleges, hospitals, support groups, and conferences to speak about her young adult journey and educate people on the disease known as scleroderma. Amy continues to provide support through her young adult support group, which can be found on inspire.com and is called the Superstars Group. This is a great group for if you're looking to connect and help one another. She is also on the Patient Advisory Board of SPIN, the Scleroderma Patient-Centered Intervention Network, and is on the Board of Directors for the Scleroderma Tri-State Chapter. Amy has worked closely with the Stephens Foundation for over 3 years, speaking at their Scleroderma Interprofessional event in Albany, and also works closely with several drug companies to raise awareness for not only scleroderma, but pulmonary fibrosis, ILD, IPF, and cardiac issues concerning scleroderma patients. Welcome, Amy Gietzen.
Thank you, Angel. Welcome, everybody. So like Angel said, this is going to be a young adult panel for us to kind of give a platform to young adults living with scleroderma so we can kind of connect and talk about different things. This one is going to be about relationships and connecting as a patient who is young living with scleroderma. So I want to go through really quickly and just introduce the panelists. I'm going to have them introduce themselves and tell us a little bit about themselves, and then we're going to get started. Like Angel said, please hold the questions to the end. You're more than welcome to write them in the chat box, but we won't take any questions until the end of the panel. So welcome, everyone. And so I'm going to start with Fatima. Would you like to tell us a little about yourself?
Yes. Hi, guys. I'm Fatima Shahab, and I am from Los Angeles, California, originally from Pakistan, and I'm 28 years old. It's going to be 14 years since my diagnosis, and I will tell you a fun fact about me. So having scleroderma and other autoimmune conditions made me go back to my art and writing, and now I am compiling all of my poetry and proses into a book, and these are all the words which me and you can all relate to. So thank you.
Thank you. Welcome, Fatima. That's amazing.
Thank you, Amy.
All right, we'll slide over to Sherman. You want to give us a little bit about your background, who you are, where you're from?
Yeah, hi everyone. My name is Sherman Ganingui. The last name is as long as it sounds. Born in Santa Clarita, California, a little suburb of Los Angeles. Didn't move too far for college, ended up going to UCLA. And that's actually where I would receive treatment ever since I got diagnosed at age 14. So I'm 31 now. So I've gone more than half my life, you know, working with scleroderma and kind of dealing with its effects. And currently awaiting bar results. I just took the bar exam last week, and I'm a director of operations at a law firm here in Los Angeles, and we specialize in a lot of civil litigation, social justice, and disability discrimination for kids.
Wow, welcome, Sherman. That's a lot to unpack.
Thanks, everyone. Looking forward to
Nice
being here.
having you here. Yeah. All right, we'll slide up to Kat Davis. You want to introduce yourself, Kat?
Yeah, hi everyone. I'm Kat Davis, or AKA Cure for Cat. Let's see here. I'm 32, but I will be 33 in a couple days, so it's always an awkward, like, how old are you? Anyways, I've had scleroderma I just passed my 10-year mark. I was diagnosed when I was 22 years old, completely healthy, and literally out of nowhere, my life was changed. And it was changed for the better, actually. And then the thing that I'm passionate about, honestly, it would be scleroderma and helping others, not only with scleroderma, but cancer, autoimmune diseases, all that stuff. I've learned through my story, my struggles, and my hardship that by being truly authentic and sharing what I go through really does help others. And that's huge for me, and realizing why I was chosen for this journey. So basically passionate about helping others get through this weird life with an awesome, crazy, miserable, terrible disease.
Welcome, Kat. Thank you for that. And last but certainly not least, we have Alejandra. You want to tell us a little about yourself?
Hi everyone. My name is Alyssa Serrano, 27 years old. I had scleroderma for 8 years. I'm also a support group leader, and my passion is just to help people. I always wanted to help kids. I always thought that kids needed help, and when I got diagnosed with scleroderma, my goal kind of changed, and now I want to help everyone that has scleroderma. And I enjoy sharing my story so everyone can learn and don't have to go through the same things that I've been through in the past.
Welcome. That's great. So welcome, everybody. Now that we kind of got a little housekeeping out of the way, I'm just going to ask like a couple, like 1 or 2 pop-up questions. So just to kind of get the feel of more about you and where we're going. So if it's a yes, I want you to pop your hand up, hence the pop-up. If it's a no, don't pop your hand up. So my first question would be, are you currently in a relationship? Yes, raise your hand. No. Okay, only one of us. So I guess the next question I'm going to direct to Alejandra, since she's the only one that's in a relationship. Did you meet your significant other before you were diagnosed or after?
I met him before I was diagnosed.
Perfect. And my last pop-up is, do you have a strong support system around you? Raise your hand if it's yes. Okay, great. We all have support, but nobody has a relationship with Alejandra. So the first question I'd like to touch base on. I know. Okay, so I'm just gonna read the question and then we'll throw it out to whoever wants to answer first, if you want to do it that way. So the first question is, do you feel like you've been treated differently? Not when you have, do you feel like you've been treated differently with scleroderma than you were treated before you had scleroderma, like in your relationships, your friendships, co-workers? Yeah, so who wants to be the lucky one to start? Sherman?
So I think, so this is like, I take this as a 2-part question. I think one part is when I make it known that there's something different, and whether or not once that's been known, the treatment follows. So until I told people, you know, I had scleroderma, no one really knew, hey, we probably shouldn't take Sherman near like the beach at night when it's 60 degrees because he's going to get cold. So, you know, my friends would still want to do bonfires and that kind of stuff, or go on ski trips. And, you know, everyone would just say, let's do 2 weeks in the snow. And no one really knew, hey, this isn't like the best environment for our friend. So as a kid, I didn't go on the snowboarding trips and stuff like that. But as I got older and I got more vocal about what's going on with me, I realized that it's not that no one would want me to come on the trip. It's just they would find other things that I could do, or like there's always someone that doesn't actually want to go skiing on the ski trip. So that's who you can hang out with and make the campfire, make some s'mores, just do other things, right? I realized once I was more vocal about it, I didn't ever get any pushback, but I actually got more compassion, right? And more people actually caring to take that extra step to, you know, accommodate me along the journey. So I've had nothing but positive experiences.
Great, that's awesome. Kat?
Yeah, I thought I'd chime in on a kind of a different angle for me. You know, I was diagnosed early on in my early 20s, you know, 22. So I was extremely active. I was basically everything I'm not today, right? And for me, I've gone through several friendship groups and I am treated completely differently. The main difference, you know, it's hard for me. I live in Spokane. It's not tiny, but I'm very well known here. I can't go anywhere without kind of being judged of what I do. So that's hard. And with my friends, I'm absolutely left out all the time. And it's, even though I'm extremely vocal about that hurts my feelings, or why can't we do something, like it'd be nice if someone would choose something that I could do. It doesn't happen that often for me, even though I have a really great group of friends, they seem to forget. And I really have to learn that, or I've learned through this, that I can't put on expectations of people who don't understand a disease. So, but it's hard because I'm definitely treated unfairly, I think, and it can be frustrating. And I've cried many tears over it because I just want to be normal. I want to go snowboarding. I want to go wakeboarding. I want to do all that stuff, but I'm extremely high maintenance since I have to basically bring my adjustable bed with me everywhere. So anyways, yeah, so on the sadder note, I've struggled immensely with it.
Yeah, for sure. I think everybody has had ups and downs as far as connecting with people and friendships. Do you feel like do all of you feel like the friends that you had before your diagnosis are the same now? Have you lost friends? I know I could speak for myself, like my core group of friends before I was diagnosed is not the same. I maybe have one close friend that was a friend since we were kids. Because, you know, I think as people grow up, you know, they change, but because I was diagnosed so young, I kind of had to grow up faster than what I
Yeah.
probably normally would have in my teens and 20s. Alejandra, have your friend group changed at all, or?
Yes, actually, it kind of changed because I got diagnosed right after high school. So we all went to different colleges. So I wasn't, you know, one of my friends that I knew since middle school, she actually went to same middle school, same high school, and same college. And I still talk to her to this day. So, you know, I lost friends, but it was mostly because we all went to different colleges. We all took a different road. And now the friends that I have, I met them after I got diagnosed.
Right. Yeah.
I've definitely had to draw a lot of boundaries with people in my life. And unfortunately, I've had to let people go because the stress of some relationships in my life were absolutely too much, and it was killing me, literally physically killing me. And so that's been really sad that I've had to do that, but it's been for the better for my health. And unfortunately, with scleroderma or any disease that you have to have those moments of selfishness in order to save yourself, because literally we're dealing with life or death, and that's the bottom line.
Right. So, I mean, within those friendships that maybe some friends that you have lost or like kind of became disconnected with, do you blame yourself? Do you feel that there's guilt in that, Fatima?
Well, actually, that happened quite recently to me. So, and this is a friend I'm talking about who knows about my condition. And so we were making plans to meet up. And so I kept having my flare-ups and I had to cancel the plans, as obviously, right? But so finally the plan confirmed and I was about to meet her, and I texted her just to remind her that I will meet her, but just for an hour or so because I cannot sit for long. And she bursted out on me. And she's like, you know what? I'm done. I'm done accommodating you in my life. And you need to understand, like, I need to understand to work around other people and I need to start accommodating other people. And it really hurt me that day because then I thought for a second, I was like, okay, what? So, like, it's going to be 14 years of my life. So every friend of mine thinks exactly the same way. And I started to question like every relationship in my life, whether it's my parents or it's my friends, my best friends even. And I'm like texting them and I'm like, am I a burden to you? And they're like, hell no. Like, why would you even think like that? So I would say, like, because of one person, I started doubting every relationship in my life. And that was like a moment of weakness and a moment of, I don't know, like maybe she was going through something and she doesn't understand like how our flare-ups can be. And even like, I think we all can relate to, like, if we go out and spend some days out and then we come back home, we are like the flare-ups can go like for months. We all know that, even hanging out for a day. So like, I think I put some boundaries on and I thought that she would respect that. And instead of respecting it, she gave me a huge lecture on accommodating. So
Yeah.
it does hurt, but I'm over it.
I don't know
Do you
about you
think-
guys, but do your friends get frustrated that you can't do, the things that they want to do, or can't go here, can't do that because it's too cold, too hot? I don't know about you guys, but my friends get really frustrated, and then I get also frustrated hearing, they're complaining, right? Having a bad hair day, the guy they like won't text them back, whatever it is. And I'm just like, if only those were my problems. Like, I would kill that those would be my only problems. And sometimes I have to like switch my mindset and be like, it's not their fault that they're not sick. It is not their fault that I'm sick, right? But it's definitely like a psychological thing where like I have to talk myself through it, because I can get into a space where I get so mad at everybody around me just by hearing their complaints. And I never want to make someone feel like their, the issue in their life isn't as extraordinary or big as mine.
Right.
But yeah, it's tough when people are complaining about petty little things, and it's like, oh yeah, almost died the other day, but cool, let's talk about your chip nail polish.
Well, I think for sure, because we are all sick, it makes us hyper aware of keeping those moments and making those memories and having, those keepsakes and kind of like not sweating the small stuff. And I think I always try to remember that, if I was healthy or normal, that stuff would be important to me. So you don't want to minimize somebody else's life choice or journey. So you kind of have to be accommodating to them, like they are asking you to be accommodating as well. You know what I mean? But I think, to speak on what Fatima had mentioned before with boundaries, do you find that your relationships, whether they're good, bad, or in between, or you're meeting somebody, do you find that you have to put boundaries in place for yourself or because of the illness? Is there like lines that you lay out for the people that are in your life, like your support system, things like that? I know a lot of scleroderma patients live with their parents or a significant other or, a roommate. Do you find it difficult to live with somebody who is that person, a friend, a family member, but also a caregiver? Shervin, do you want to touch on that?
So yeah, my living situation is actually a little bit more unique, I'd say.
Okay.
I'm living with law school classmates, and we all just graduated and took the bar. So, I am 31, so moving back home isn't likely what's going to happen. Once results come out, I'd hopefully imagine getting my own place. But my roommates have been, nothing shy of amazing and accommodating. We all became roommates because we were good friends at law school when I was actually living with someone else. So in terms of understanding and stuff, my roommate also has something called endometriosis, and her boyfriend has another thing that he deals with an irregular heartbeat. So you know, we all kind of have something going on. You know, someone's visiting the doctor once a month or like, but at the same time, it's like, you know, we're all taking care of each other, making sure everyone has what they need. So I've been really blessed in that aspect in terms of the living situation and the roommates. So.
Yeah, for sure. Does anybody else have had experience with maybe living with your caregiver or your support system and finding, you know, that I know myself, I sometimes find that they over worry or they want to be supportive 100% all day. And I like to have my independence and I like to do things for myself. You know, Kat, you want to touch on that?
Yeah, so I live with my mom because I'm super cool. And it's really, really hard because if you guys follow my journey, you know, last night, for instance, I was in the hospital deathly ill. And, you know, today I feel better. And so, but for my mom's mental state to be there with me last night, going through that horrificness, and now today we're switching mindsets that I am able to be by myself, okay, all that kind of stuff. It's honestly, it's emotional whiplash for her. And I really had to come to realize that just because I feel okay today to like go out and do and or do this per se doesn't mean that she's ready to go see me do that. And that is something that like we have to work on constantly because I am almost 33 and I get easily frustrated that like I just want to live my life, like, you know, but then
Yeah,
2 days later I'm throwing up and can't go to the bathroom by myself.
right.
And
And you're
so
like,
it's
Mom.
constantly this push and pull of like, I need you, but leave me alone. And
Right.
it's really hard, but like the only thing that I can tell people is just like you have to communicate. Like we're in constant communication of how we make each other feel because we hurt each other's feelings. Then, oh my goodness, it's literally like a relationship.
Right.
I
Well, it
wish I had a relationship with my mom, but yeah, it's really hard. And I used to in the first years of my diagnosis for 6 years I lived with friends. So I've kind of done it all, but this is the hardest. Yet I love it the most because I need it when I'm sick.
Yeah.
Which is often, right? Like 3 times a week at least I need her. But all the other days I just want to be pretend like I'm normal. But
Right.
yeah, so
I know Alejandra, you have a spouse, so is it kind of the same as Kat, where you feel sometimes they're overly supportive or want to do everything for you, or do you find the communication is a little better?
I feel that our communication is better. One thing we really don't talk about is scleroderma. You know, yes, I have scleroderma, and the people that I live with know, but it's not something that they will remind me every often. Oh, you have scleroderma. Do you need? No. They understand that when I need help, I will ask for help. And with my husband, he does really overprotect me, but the same way, he will never remind me, oh, you have scleroderma, you can't do this. No, he would tell me, if you can do it, just let me know, and that's how it works. You know, I don't like being reminded I have scleroderma or you can't do this, you can't do that. No, I prefer me asking, and I had to learn because I didn't like asking for help, and I think all of us can relate. We don't like asking for help because we think we have everything, but we can't sometimes. So I had to learn to ask for help, and that's how we do our relationship.
Great, perfect. So I want to kind of change gears a little bit in what we're talking about. So for those of us who are single, which is pretty much everybody except Alejandra, do you guys feel comfortable dating with scleroderma, like with a chronic illness, with all the baggage that comes with it? And if so, why? And if not, why? Fatima?
I would say like a big yes, because in my mind, I'm like, the disease does not define me. I know it's going to put like restrictions on me how to live my life and all. Like, I need to work around it, but it definitely doesn't own me. Like, I can live on my own. I can make choices. I can go out on dates. I can meet people, like new people and all. And for me, it's like if I like the person and the other person likes me back, so slowly and gradually I start to tell them about my condition. And I proudly say that, like, this is what I have, and embrace it fully. Because I feel like if I hadn't had scleroderma, I wouldn't be here right now. I wouldn't be accomplishing the dreams, the life that I am building for myself. So yeah, so instead of like being embarrassed, instead of like being pity on myself and just like, oh, I'm sick, I don't do that. It's like, yeah, I have this condition, so like take it or leave it. And I feel like the people who stand by you on the day, like on the day one, will be there till end of the day. And the people who are like somewhat confused and all, so I would rather say like move on. Yeah, it's like, so yeah.
Have you ever had someone that you're dating or that you're connecting with just be like, I don't want anything to do with you after you told them that you were sick?
Oh yeah,
Somebody?
it happened after my diagnosis. Yeah, it was like a high school crush and all, and I told him that. And at that time, I was like confused and I did not know what is happening in my body. And so I told him, and I'm like, you know what? I have scleroderma and I have like other conditions and all. And he like, like he just like rightly said that on the phone. He was like, you know what? I don't think it's gonna work out because my mom will not approve of you. So I was like, okay. So like years down later, I'm still like, whenever I'm like meeting someone new, that thing still haunts me. Like I know I'm confident, I know I'm like, I fully embrace this, but that statement, it just comes back to me.
Yeah, for sure. That would bother me too. I mean, I had one relationship where I first started to get, it was when I was first diagnosed and I was starting to get involved with the chapter and I wanted to do the walks and everything. And this person looked at me and said, I don't want to be around people that are sick. And I said, well, I'm sick. So that means you don't want to be around me. It was just like an awful thing because then you think it's my fault. It's because I'm sick. I did something wrong. It's like that first
Mhm.
knot in your head that you go to each time. And, you got to kind of deal with that. Kat?
Yeah, I think this is this is an awesome topic to be talking about because within the scleroderma community, especially those in the 20s and 30s and even really 40s, this is something that is a huge issue, and it's scary to date when you look different. And for a lot of us, we don't have lips anymore. Our hands are, we are missing some fingers and hard skin, all of that. So like exactly. It's a huge topic and it's good to be extremely authentic about. Yeah, I really struggle because just via social media, right? I share everything. So super not cute, let me tell you. The guys aren't exactly lining up for the girl who throws up on video camera for people. But yeah, it's really hard. And like for me, now that I am considered terminal and I am going downhill fast, it's like, how do you bring someone in that? Do I want to bring someone in that? It's really hard, but we're still all, people tend to forget when you're sick that like we still are normal. Like we still want everything everybody else wants. It doesn't make us less than, it doesn't make us broken or anything. And it's really frustrating because people, I don't know about you guys, if you've ever experienced this, but like if I'm with like my group of healthy friends, right? So I feel like I have sick friends and healthy friends, whatever.
Right.
Let's just call it spade a spade. So my sick or my healthy friends, like they'll, talk about guys and everything, but no one ever asks me if I'm seeing anyone. Like it's basically in their mind, it's like out of the realm that would ever happen to me. And that's hurtful, like for people
Yeah.
to assume because I have an illness that like no one will be interested in me because first off, I'm awesome. So I
Absolutely.
know people like me and I'm the coolest person ever. So I don't struggle with self-confidence in that way. It's more of the details of do I want to, I think when it comes to me for dating, is it, will the person respect that one day I'm fine, quote unquote, and the next day I'm down for the count? That's what I struggle with is people don't understand how you can change from literally hour to hour, right?
Right.
And a lot of people I've dated, it's been like, what do you mean you can't hang out tonight? You were out. with your friends yesterday, and it's like, I know, but then I woke up today and for whatever reason, you know, I'm sick, and it's just really, it's really, really complicated. And most people that I've talked to, and I've been, you know, speaking to people with scleroderma for 10 years, a lot of husbands and wives have left
Right.
after they're diagnosed. That's extremely common for the people to be left because they can't handle sickness. A lot of people don't want to date because they're so self-conscious. A lot of scleroderma patients, I don't blame you, don't even have their picture like on Facebook as their profile picture because they're that, you know, upset about the way scleroderma's changed their appearance. And it's just really devastating. And I just want to say, whoever's out there right now, like, I get it. Like, that is, my heart breaks for you, and you are not alone. Trust me.
No,
And
not at all.
it just, it's, yeah, this is,
You know, because I feel like
not just
there's,
a taboo, you know.
yeah, there's the connecting part with people and wanting to have love and wanting to have companionship, but we also have so many hurdles to get over. Like, you know, I was very uncomfortable with my skin and myself when those first 5-10 years I was being diagnosed. I changed so much. I didn't like the way I looked. I didn't want anybody to be intimate with me or touch me or kiss me, you know. But you have to kind of grow into your skin and realize, like, even though you may not like the way you look, somebody else may love the way you look. And
Yeah.
it's hard. It's very hard because you constantly are taking hits. You're taking hits because you're sick and all these things are happening to your body, but you're also taking hits because friends maybe don't want to be friends with you anymore, or boyfriends or girlfriends don't want to be with you anymore. So I feel like that's why this kind of connecting is so important, so that you can kind of figure out where you are in your life, and you can need somebody to like tell you, hey, get back on track or get out there, or do something like that. So that was
Yeah.
great. That was a great comment about that, Kat, that like you are not alone.
Yeah, please. I know how much scleroderma changes your appearance, and that's just one tiny % of what it destroys. So if you're out there, like, please reach out to one of us.
Yeah,
because
absolutely.
we've been there, and like, please don't be embarrassed. Like, I'm sure whatever questions you're thinking or have, we've all thought them.
Yeah.
And I'm sure I've said them out loud. So
So on a kind of in keeping that same tone of relationships, do you feel like, or how do you separate your disease from your life? Like, do you compartmentalize, like, or do you, because I used to be like, well, the disease is not my whole life. I'm a separate person, but the disease is definitely like 90% of my life because it affects everything in your life. So how do you incorporate that with your personality, or what you love and what you can do and what you can't versus what you can't do? Does anybody want to kind of grab a hold of that and talk about it? Fatima?
Well, to answer this question, I would say like it was affecting me in the past, right? When I was like diagnosed and then I got like really, really, really sick. And now since like I would say like 5 years or so, I have been trying to change my mindset around it, because I was like, the disease, obviously the disease does control me in a way, it does control my life and all. So how can I work around it, and instead of like fighting against one another, be friends, right? Just like, okay, like have like raise the white flag now. So I try to change my mindset. So now my mindset, so I used to be like very cautious on how my hands look and my toes look and my elbows look, because everything is bruised, everything is like wounded and scars and everything, right? And it's like bleeding and all. Like right now my knee is bleeding while I'm talking to you, and you guys understand that. That is the thing. So the thing is like, so what I changed, I was like, you know what, I'm a strong warrior. And these are because I have gone through so much in my life, these are my scars and I need to be proud of. So whenever anyone asks me, they're like, oh, so what happened to your elbows? Or why can't you, like, why are you shaking with your left hand? Are you a lefty? Well, I can, like, my right hand doesn't work now. But so like first I used to like start to cry and like weep myself for for nights just to like when anyone asks me like why I'm not like able to shake hands and all. Now I'm like, well, I'm a lefty now. Like I proudly say that, right? Because I'm like, I don't need to like clarify or give an explanation to every other who is like coming and meeting me. The people who knows me, okay, fine, that's fine. But it's like I don't need to give any justification how I am living my life now. So,
Right.
and
Well,
I
now
would
with
say
the
like
COVID, now with the
yeah,
COVID, you don't have to touch people's hands anyway. So
exactly, exactly. It's just like stay away 6 feet, right? Maybe 12 feet even. So now it's just like changing the mindset. It's like surviving and thriving at the same time has helped me a lot. Like it has really helped me a lot. Like
yeah,
I am surviving. Like I know how to go on with my life now.
yeah,
I
for sure.
try to use my disease as a talking point and a way to raise awareness for this disease and
Mm.
or mental health or whatever it may be, because I can't separate the disease anymore. I'm too sick, and that's totally okay. I feel because I'm sick, I've lived an extremely deep life, and that is a gift that I could never, you know, I could ever be more thankful for that. And so, when I shake someone's hand or, people are very like, you're sick, because I
Yeah.
can, now that I've had 2 stem cell transplants, I can hide the scleroderma parts especially when winter comes around. My hands are a little different, but the moment someone hugs me, they know something's different. And that's okay. And I just feel like, oh yeah, have you ever heard of scleroderma? Like the stupidest disease ever, but let me tell you about it. And I just make it like a joke, but I also like, I want to inform people because I think it's just so important that we do that. So I try to incorporate that with, I don't know.
Yeah, with everything. I think
Yeah.
like, as women, we have a different view on how we view ourselves or review relationships or review dating and things like that. Sherman, as a man, do you feel like it's harder to date or easier to date? I know women are very much not superficial, but we very much care about the way we look. Like my hands, it was a big issue in my confidence because, if a guy loses a thumb or a toe, they could just be like, oh, I ran it over with the lawnmower. But, women, we wear rings and, so it bothered me. But like, how do you think as being a man in like the pond of dating?
Again, it's like I think one part is where I'm at. I'm in LA, so there's going to be a whole perspective on dating simply because you're in Los Angeles, right? On appearance and all that. Now, before scleroderma, I may have been 6'3", tall, handsome, tan, like a GQ model. Post scleroderma and all the my entire lineage of men in my family is tall. But that really changed quickly at age 14 when I had to take methotrexate and other things. So, my dating life was, typical kid in high school. And then everything really did change until I became more confident in my own skin in my probably like mid 20s. So I feel like growing up, they say you mature and you age like wine, right? Like with age, you get better.
Yeah.
Well, I rock that. I take that phrase and I run to the cleaners with it and I milk it every time for what it's worth. It's no mystery that I look different, right? It is what it is. You ask girls in Los Angeles and they're all looking for the next guy that's going to be on The Bachelor or The Bachelorette.
Right.
I probably will not be casted for that position anytime soon.
You never
Yeah.
know.
You don't. I agree
They
with
can have the
that.
chronically ill bachelor and bachelorette.
I've noticed
That
they've
would be
gotten a lot more open to casting now, but I haven't let it stop. There's like what 6 billion people on Earth now,
Right.
so I could sit there and worry about all the girls that didn't swipe right on my picture, or I could just move forward and realize that even if half those 6 billion are women, and even 10% of them are going to fall into the age group and they're within the proximity or whatever it may be to be interested in me, that still leaves a ton of people out there, right?
Mhm.
For sure.
And I've
True.
watched 90 Day Fiance, and let me tell you, you
There's
watch
people
that
for
show,
everyone
and
else.
there's exactly. You ever feel like there's not someone out there for you? Just watch 90 Day Fiance.
Or that, what's the other one? I'm dating somebody in jail or something like that.
There's a
Yeah.
million of them. A famous celebrity just helped get a gentleman out of jail, and then they got married not too long after.
Wow.
Yeah.
Okay.
These things are beautiful events that happen in life, and
Yeah.
it's like I think of all the positivity, and that's what I hold on to. Until I get knocked off the horse, I'm just gonna keep looking towards the sunset and riding forward.
I
Exactly.
think that's extraordinary, and I love that you're at that point in your life, and just yeah, keep doing you, guy. And also, by the like, speaking of, I wish they would just do more things and bring awareness to people with disability, because they're doing a lot with autism now, which is extraordinary. Like Love on a
Right.
Spectrum, everything's okay, and that's really opening people's eyes of they're just normal people with extraordinary brains,
Right.
And I wish that they would do stuff like that for disability, because just because we have disability and disability, talk about a spectrum, like not even the five of us, we're all so different on how our symptoms present, how we look, what it's taken
Exactly.
from us, what we've gained. I don't know. It's just, yeah, I think it's important for people just to remember that, like I keep saying, like, no one's alone. Like, there's so many of us out there, and unfortunately there's a lot of people who just aren't, just don't feel comfortable coming to speak out yet. But we
Yeah.
see
Yeah.
you. We see you if you're not speaking out. Like, we're here for you.
So I've always wanted to know, like, because I've thought about this a lot. If I found somebody, like, say I went to the national conference and I met somebody out of state or somebody that didn't live where I lived, and I fell in love with this person, would I pack up all my things and move, like, away from my support system, away from my family, away from, well, my doctors aren't local, but if you had local doctors, like, as a chronically ill person, like, would you take that leap and go?
I've done that before and it's not good, but go on.
Sherman?
I think I got the weather thing going, so I am fully offering that support to anyone that would want to come over. That's one of the pitches, right? Like, that's my pitch, is like, I got sunshine in California, like, come on by.
Yeah.
If someone really, really, was understanding, and I could overcome all the career stuff, because I literally just spent 3 months studying for that exam, I would totally do it, as long as the weather was right. It really comes down to the weather, right? Because I think for all of us, like, the cold weather is really the thing that hits your hands, gets on the internals. As long as they didn't live in Alaska, and if anyone's watching from Alaska, it's beautiful from what I've seen up there. It's just a little too cold for my taste. I think it comes down to, like, being willing to make that change for your own health. If it's not too much on your health, why not? Right?
Right.
You can fly back for the doctors, but you
Yeah.
can't change the weather. That's the big thing. 365.
Yeah, that's true. That's true. Kat?
So for me, I live in Arizona. When I'm in Spokane, Washington, this is where I was born and raised / live right now. I was in Arizona when I was diagnosed. So I've definitely done the whole live where the weather is. And, unfortunately for me, right, we're all talking about ourselves and our sickness. I'm absolutely too sick to move away. It's taken me years to get the extraordinary team of doctors I have. So for me, it would be detrimental to my mental health. It would be detrimental to my health. When it comes to doctors, my support system here is extraordinary. I have a whole town backing me up, and then I have family and friends here. So no, I could not. It's not even like, oh, I don't want to. It's like I literally couldn't. That wouldn't even be an option for me. And I know a lot of people are just like that. And it's a bummer because I would love to like go and do and travel, but like I just don't have that luxury of being able to do that anymore in my disease, right? We're all in different parts of our disease, but it's hard
Right.
because like sure, I would love to be spontaneous like I used to be, but like I just that's not in the cards for me anymore. Unfortunately, I have to be like, where's my doctor? Where's my mom? Because I can throw up. Like,
What about you, Fatima? Would you relocate for love?
Will I relocate for love? Okay, now
Yeah.
I'm thinking. I would say like if he's worthy enough, he would relocate for me to Los Angeles.
Yes, girl.
there
Right?
it is.
But yeah, because like I have lived in Pakistan, I have lived in Dubai, I have lived in New York, Detroit, Chicago. Until now, Los Angeles has been the perfect weather for me and for my health. So even now, like as I'm sitting in my parents' house right now, I cannot wait to fly back to Los Angeles because like this weather, like it's killing me. It's killing my body, my skin, everything. So yeah, so I would like if I was like 17 years old, I would have said yes, I would relocate for love, but no, now I'm sane and more like I know what I'm doing with life, so I would say no, I would not. It depends on the place though, especially not to Alaska, Sherman. No one is moving there.
Hey, Buffalo
But
is, I'm
yeah,
from
but
Buffalo, so it's pretty cold.
it is pretty
Freezing here
cold,
too.
right?
Yeah.
Same. So no, we wouldn't be relocating to a colder region. It's like sunny California, I think would be the best option to live.
Yeah, for sure.
Absolutely.
For sure. Do you guys feel, I know I touched on like physically how the effects of this disease have changed, like your relationships and your social experiences, but do you think they've changed your image of how you feel about yourself, your confidence, how you look at the world? Like, I know when I was diagnosed, I was angry and very upset that I had scleroderma. I didn't want anybody to know. I didn't tell anybody for a long time. I definitely didn't advocate like you see me now. I was not doing all that. I was like, if somebody said I was sick, I would be like, what? Slap that person. Like I was definitely not all of this gracious, empathetic person that you see before you. So I just wondered, like, how did you guys come to be the beautiful people that you are now and so confident about yourselves and so open to talk? Shervin?
Well, yeah, I mean, I thought I'd be, 6'2" like my uncles, like the rest of my family, 190 pounds playing ice hockey, trying to get a D1 scholarship. I grew up playing hockey and ice hockey as a kid. That changed really quick when scleroderma hit, right?
Yeah.
So that, doing sports in high school, growing up, always thinking, you're going to go to college to play sports and that's how you're going to pay for it. And then that's kind of taken away. It definitely changes changes the way not only you feel about yourself, but your game plan, right? I went from looking at the best sporting schools to, hey, where am I going to be able to go? Because I want to now be a doctor to change my course of my own life, right? So then I spent high school trying to figure out the best place to go to put me in a position so I can cure this disease. And then you have this dream and you get to college and you take your first biology class and this world-renowned professor puts you in place and you realize, wow, maybe med school isn't as easy to get to, or maybe with my condition and my doctor's appointments and the stress and working in a hospital, the hospitals aren't the warmest places. I don't know if you guys have been there recently, but they keep it pretty chilly in the hospital. So I started realizing it's like a beautiful dream to want to cure this disease, but then I started becoming more realistic. How can I really, really make an impact to not only change the outcome of this disease on a global perspective, but also maintain some way of moving forward myself. And then, as I grew up, I realized there's a way to balance, professional life without being in a hospital. And, it led me to law and advocating for people with disabilities and kids and, all those other things that I get to do today. Yeah, the physicals changes changed me. You will not be seeing me playing at Staples Center for the LA Kings anytime soon. But it definitely opened up a whole new avenue and channel of me connecting with people. It made me focus on my personality, and I've been told I'm kind of funny and entertaining, and I've tuned into
Mhm.
that, right? I didn't give up on sports, but I honed my talents and my efforts into working on other parts of myself, mostly my personality. So,
Absolutely.
yeah, it definitely changes your physical, but it depends how you take that energy and how you realign it.
Yeah. Kat?
The moment for me when it clicked why I was chosen for this specific journey and to suffer like I do, um, was one of the first times I decided to be authentic on social media about, something I was really going through. The feedback of people just, you know, being so, feeling so heard by just me sharing my story, right? Um, it just changed my world. And because of scleroderma, I now know what I was created to do, which is help people raise awareness for this disease, share everything disgusting about my life because I frankly don't care. Um, I have nothing to lose at this point. But I think but saying that, like, not everyone lives my life, right? Not everyone has a town um, that is behind them because I've had two huge successful campaigns. Like, I am the exception to the rule, I feel, not in like a big headed way, but I just want to make sure people understand that like us five is not something you have to aspire to be or feel
Right.
like you're less than. Like, please, this is not a comparison thing. This
Mhm.
isn't like I'm better than you or none of that. All of this is like through these questions. We want you guys, all the listeners out there to, hone in on what brings you joy. And maybe that will be something that has to do with scleroderma, or maybe it won't. And that's totally okay. Like, don't
Right.
feel like you need to be helping within our disease or
No.
community to be of something of importance. If you love reading, that's awesome. Like there's just so many things. So I felt led to say that. So I want to make sure everybody
Yeah.
knows.
No,
Because
of course
some of
we
your
want.
answers are great, but they're also like, what the?
Yeah, of course, like our stories and journeys are completely different than, anybody else that's in the scleroderma community. And, the only really commonality we all share is that we have this disease,
Yeah.
that the disease changed our life. And, just because my life is a little different than, say, Susie Brown's life doesn't mean her life is any more mundane.
Yeah.
I think this platform is just for us to share a little bit of the struggles that we all go through and make people feel, young adults feel like they have a place to, feel safe enough to say, I'm struggling with this. I feel this way about myself, or, and trust me, of all the people here, I was probably the least willing to speak up about my disease. If you would have seen me 10 years ago, I was a completely different person. Before I was diagnosed, I was very selfish. I was very self-centered. I, was not a very nice person. I did things only to self-serve. Like I can say now I didn't really like that person that I was, but this disease has changed
It's
so
humbled
much
you.
about me. It has humbled me. It has made me more empathetic. It has allowed me to embrace not just myself, but everyone going through this and change people's lives. And I could never, even if it's just one person, I'm never going to go back to that person that I was before. And, even though scleroderma is a debilitating and it can be terminal and it's a chronic illness and it's this, and this, it has changed my life for the better.
Yeah, well, and I think people, when we're sick, people tend to live this deep, right? Very,
Right.
very thin. They don't dive deep. With chronic illness, like when someone says to me, "Oh, I've just been recently diagnosed," obviously I hate that for them, but I'm also like, welcome to the sick world, which is extraordinary. And we get to see things that people will never see. We get to really understand how precious every minute of life is. And that's a gift. Like, we do have like a superpower. And it's good to make sure that you really try to focus on some of the positives and the joys that it does bring you.
Right. I mean, don't get me wrong. Being diagnosed as a teenager, which I'm sure you guys can all, you know, kind of agree with, it was really hard, and it makes you kind of second guess yourself, your appearance, your friends, your relationships. And in that aspect, do you feel like growing up was like maturing? Do you feel like you guys matured more quickly because of this disease? Do you feel like you are more outspoken because of this disease? Do you think if you were a normal person growing up, you would have made the same choices as you did? Alejandra?
I think since before I got diagnosed, I was a really quiet and shy person. And after being diagnosed, years, I was still quiet. And then after a couple of years, I noticed that I had to speak out. And I noticed that I had to defend myself, because if I didn't defend myself, no one else was going to. So it made me more stronger, and it made me talk more about that I have scleroderma. It made me want to help people more and be the person that I am today. And I'm happy who I am today. And I like that I'm more outgoing. I speak more. I have more confidence in myself, because I had no confidence in myself before, and now I do. So I am happy of where I am, and I think scleroderma helped me get to where I am right now in my life, and I really like where I am.
Good, I'm glad. I mean, it's not like we're all glad that we have scleroderma, but you know,
Exactly. Amy,
I think that, yes.
don't you feel like, I don't know who all out there has been to like a scleroderma conference, for instance, but like scleroderma people, guys, we're sassy.
Yeah,
Like,
we are.
like, I don't know if you agree, Amy, but like almost everyone I know, because we've had to advocate so much for ourselves, that at some point we get to this point where we're like just sassy. I feel like that's the only word I can say, in like the best way. But like,
Yeah.
we're funny, we make jokes, and we're really truly a very special group. And I know if anyone's been to a scleroderma conference, you know what I'm talking about.
Yeah,
Like,
I mean, we're very special, and I'm so grateful to meet all of these people, all of you guys, these amazing friends, and connect with all these people and have relationships with people who know what it's like. But, you know, if you turn the spectrum around, we've lost at least 7 scleroderma
at least
patients from the community, just with this, not from COVID, but in this COVID span. And, you know, it's very hard to, everyone's like, you need to connect, you need to find somebody who's going through what you go through, and make friends and be in the community and reach out. And then you do, and then it's like that person passes, or, you know, someone else you know passes, and then you feel like, why am I doing this? Like,
yeah.
why am I letting people get so close to me if I'm going to pass away, or if they're going to pass away? And, you know, I really had to like kind of reevaluate, like, why am I doing this? Because you know, it's devastating to lose somebody, but to know that we're eventually going to lose a lot more people, you kind of have like that. I know Kat and I have spoken about this, like that survivor's remorse. Like, why me? Why did I live instead of this other person? And that's hard. You know, it's really hard. I don't know if any of you guys have felt that way. I've lost
so many people close to me, so many. My first core group of scleroderma friends, I'm the only one left. There were 5 of us, and I've only been sick for 10 years, you know, and I'm literally the only one left, and they've all died. And yeah, I mean, honestly, I'm to the point where I'm desensitized by it. I've lost so many people to this disease where I think I've had to put up, you know, kind of, I don't know, not wearing my heart on my sleeve so much for scleroderma people, honestly, because I know what's coming, but I'm also going to be one of those.
Right. You know, so you got to kind of take it
Eventually,
with
you
a grain
know,
of salt. Yeah.
but yeah,
Yeah.
it's extraordinarily hard, but I guess that makes you love others more, right? It makes you love deeper. It makes you want to call people more often. Like
Yeah.
that's kind of how I see it is now I truly understand, dang, life is precious. Like we have
Yeah.
no idea when we're gonna see the next person or what's gonna happen overnight. Because for us, one of us could aspirate, right? Bam, gone. Like
Right.
it's crazy.
Yeah. It's crazy. Fatima, did you want to say something?
Yeah. So, like I agree with you, Kat, and I think that that's what life is about, right? Like I lost my best friend like 5 years ago in a car accident, and she was not sick. She was healthy as a horse. She was driving, and her car totaled, and she died on the spot, right? So I think like us being sick and still being so privileged that we are here and talking to each other about conditions and relationship and mental health and everything all together, I would say like we should like open our eyes and see how blessed we are and how short life is. So instead for like taking granted for all those little moments and all of our loved ones and all, instead we should start appreciating them. And life is short, so I would say like let's do what we love to do instead of wasting it and whining about it and crying about it. It's just like this is it. This is what we are born to do. Okay, we are scared. We have scleroderma. We have a disease and all, but this is how we will choose to live it, and
Yeah.
that is a part of life. So we need to like embrace it and just like start living it fully.
Right.
Well,
I love
and
that. I love that. I think that's so great.
I think that's absolutely beautiful, Fatima. That's like it's literally
Thank
gorgeous.
you.
So to kind of in that same realm, I have like one more question before we kind of open it up to the public to take their questions. But I always like to ask this when I meet new people and when we all come together. But I'd like to go around and say, what's one thing that you're grateful for right now at this moment in your life? Does anybody want to go first? Sherman?
I am just super grateful for my family.
Mm.
Just their hearts are beating, my heart's beating, we're alive. That's couldn't be any more grateful than that. I could have student debt, I could have a job, I could not have a job. None of that really matters. Just being able to wake up to see another day is just such a blessing. And knowing that they got to wake up with me, that's hands down my answer every single time.
I love that. I love that, Sherman. Thank you. Anybody else? Alejandra,
Yeah.
you want to go?
Oh,
Sorry, Kat.
oh no, you're
You wanna
fine.
go?
I was just gonna say, for me, like right now in this moment, I'm so thankful for my mom. You know, we were in the hospital last night till almost 4 or 5 in the morning, and she sat on that crap chair. And you know, for all the my mom's 75, guys, like
Yeah.
she's no young chicken. So, you know, she sat there and as I was in the bed and she watches me suffer all the time and she can't do anything to make it better, even though I wish she only could know how much she makes my life better. But yeah, I'm really thankful for her. And now she's out, you know, with helping, you know, take care of my dog. I'm just like, I'm very, very blessed to have such an extraordinary mom. And my dad died a few years ago of Alzheimer's. So I have lots of siblings, but you know, there's just nothing like a mom, and I know how blessed I am, so I'm thankful for her.
Yeah, your mom is amazing.
I
She's a
know, and she's
special
really
lady.
funny, so that helps.
Yeah. Alejandra?
I think like Kat and Sherman, I am really grateful to have my family. I'm grateful for my mom, Kat. I know how it feels to have an amazing mom and always be there and change everything that their life so you can be their number one priority. I'm grateful for my husband. He's a great, really great man. I'm thankful that he stayed with me and this disease didn't scare him away. And Both of them have been there since the beginning of my diagnosis, always helping me, always making sure that I feel better, always making sure that I'm comfortable with whatever I'm doing, supporting me through all my craziness that I have done. And I'm really blessed that I have both of them by my side, helping me and supporting me. And I don't know what I would have done with that if I didn't have either one of them in my life.
Oh,
Alejandra, so blessed.
yeah,
So
that's
stinking
amazing.
blessed. That's incredible.
That's awesome. Thank you, Alejandra. Fatima?
Well, as
Anything?
everyone said, I'm grateful for my mom, to be honest. Like, she pushes me to be extraordinary. For my dad as well, because he's going to see this in the morning. So yeah, I'm grateful for both of them, especially my mom, because she's awesome and she has made me dream big, and she has made me the person I am today. So if it wasn't for her support, I wouldn't be here. I wouldn't be this tough, because she is tough, so she has made me tough to conquer everything altogether. So yeah.
Oh, that's amazing. That's
What a
awesome,
gift.
guys.
Yeah.
So for me, I'm grateful for, this is going to sound really odd, but I'm actually really grateful to have this disease.
Mm.
I'm grateful not to suffer, but you know, they always say that God gives you what you can handle, and it gives it to the person who's strong enough to fight through
Amen.
it. And I'm so grateful that nobody else in my family has this,
Mhm.
that my nieces and nephews don't have it, that you know, my sister and my brother don't have it. If it was going to be anybody, I'm very grateful that it was me.
Oh,
And I'm also grateful to have met and still be able to meet all of these amazing people that have changed my life, like little by little, you know. And I don't want to get emotional about it, but like it's so like, you guys are all so amazing. We're all so blessed to kind of be in each other's lives, even if it's for fragments. And so yeah, I'm just really grateful to have scleroderma. It allowed me to do all of these things that I love. So
Well, and
yeah.
Amy, I think it's important, you know, for people to recognize that, like, if us right here, us five did not have scleroderma, this would not be happening. If you
Right,
didn't
for
have
sure.
scleroderma, you would not be leaving a ripple effect of awesomeness.
Thank
I
you.
mean, like, honestly, like, everything happens for a reason. We're sick for a reason, whether we found out why that reason is or not. Like, you know, so you're extraordinary, Amy. And I just thank you for giving so much of your life to help us. Like, it's amazing. And I see how strong you are. I see your struggles and all of that. And
Aw,
you're very appreciated. And we love you.
thank you. You're so sweet. Sherman, you had your hand raised?
Yeah, I just wanted to piggyback off what you said because I was actually kind of thinking about I was thinking about that the other day. Statistically speaking, right? No one else in any of our families, no one else in anyone else's family watching this, statistically speaking, if the data is accurate, will be diagnosed with scleroderma, right? So in a way, each and every one of you and everyone watching that also has this, we're all warriors on behalf of our families.
Yep.
Yes.
Yeah.
Literally. I saw Mulan as a little study break, and there's that scene in the movie where the father can't go serve. We all serve for our families. So every single one of us is a warrior. And thank you, Amy, for reminding us of that.
Aw, thank you. That was a really good analogy, Sherman. I like that.
Irvin, geez, coming with the got it.
So, you know, before we wrap up, we're going to take some questions from the audience. And so, Angel, if you want to try to facilitate that, is there any questions that people wrote in or are asking about?
Yes, thank you, Amy. And I want to thank all of our panelists for such a wonderful, deep conversation that we've started here. And yes, we do have a few questions. We'll go ahead and open that. I'm joined today by two of my colleagues, the Director of Programs and Services, Carrie Connolly, and the Director of Chapter Relations, David Murad, and they'd like to open it up to questions.
Perfect. Hi, guys. Hi, David. Hi, Carrie.
Hi. Well, first, thank you all to the panelists. Thank you so much for sharing Sutton's intimate details of your life. I know I've learned a lot just listening in. So we had a few questions come in. The first one is, when you're entering the dating scene or meeting new people, when do you disclose your diagnosis?
Ooh,
That's a great
that's a good
question.
one. Sherman?
Typically, when you're halfway to that marker where you're ready to introduce them to your parents, right? So there's like 10 yards before you can introduce them to your parents. I'd say about 5 yards in. So depending on the person, it's like the third date. It could be the 10th date. It really depends.
Yeah.
But halfway mark to when you're really going to introduce them to your parents and you're thinking about Thanksgiving dinner.
I think maybe
I
it's, go ahead,
actually,
Kat.
I disclose it pretty well. Everyone knows me here, guys. So it's like, oh, you're that cat. Oh, you're Cure for Cat. And I'm like, is that a good thing or a bad thing? Awkward. I'm like, are we in love or are you just wanting to say hi? But no, I disclose it really early on because not only is it my world because I'm sick all the time, but also because you guys are my world. And helping others with scleroderma is my world. And so I can't not even have a conversation with one person without somehow bringing up scleroderma. And so for me, really early on, probably have shot myself in the foot about 1,000 times, but oh well. But that's what I do. I mean, I am who I am, right? I can't change my disease. And plus, if you have tell all signs, it's not like they're blind or they can't feel your rock hard skin. So generally that leads to why is your arm as hard as a brick wall? And then, you go into
Yeah.
the lovely.
I think it's like, however you feel most comfortable with that person. It might be one day with one person, and then if you meet somebody else, it might be a month from now. So yeah, for sure. I think it depends on how comfortable you feel with that person. Great question.
Thank you.
Hi, this is David. Thank you all for this great conversation today. And I have the next question. What advice do you have for someone who is currently in the diagnosis process?
Ooh,
Ooh.
I definitely have an answer for that. People come to me a lot for this. And my absolutely number one, I think to tell them is buckle up and get ready to advocate for yourself. And if you want to see a difference in your life, if you want to get on that med, this or that, unfortunately, you're going to have to do it. And, in the medical world today, it's not the doctors leading us, right? It's us leading the doctors, unfortunately. And it's something that people need to know right off the bat, because a lot of people will then go years and years without seeing the correct specialists, and which is detrimental to their health and then can set them up for absolute failure and closer to death. And so my number one is always, you got to learn how to advocate for yourself and also be truthful about your symptoms. People are kind of embarrassed, and I'm always like, don't ever, whatever weird thing you're having, can guarantee you it's scleroderma. So that's my advice.
Anybody else want to comment? Fatima?
So I would totally agree with Kat to advocate for yourself, because doctors do not know what they're doing, especially when it comes to us. And other than that, I would say, like, be open to your support system and ask any help you want from them. It's like, do not feel ashamed that if you want to open a jar and you cannot do so, don't worry, just ask someone to do it. It's like, do not feel ashamed or just like sad about it. But it's going to, like, because obviously things will change and we need to start embracing them, and having a strong support system and keeping your mental health in check would do wonders for you, definitely.
And
Yeah,
no
I
matter
think
your disease, connect with others who have your illness. Like, definitely get on a support group, reach out to one person with that disease, and it'll make you feel so much better and you'll feel so less alone. And don't be scared to, it's scary, right? If you Google scleroderma, the faces you see, just the look alone is terrifying. So I remember that, but like, connect with someone.
Yeah, I think just to piggyback on that, you know, locally, I couldn't find a lot of people that knew what scleroderma was in reference to like medical treatment. So I advocated for myself and found the best team that I could, even though it's out of state. It's like 4 hours from where I live, but I've been with them probably 15 years, and I'll be in year 20 of diagnosis this February. So I think don't be afraid to not shop around, but look for people and medical people that you feel comfortable with and that will treat you the way you want to be treated. It's never okay to accept less than, especially when
Amen.
it's your health. So that was a great question, David. Thank you.
So, the panelists, you touched on this, but maybe you can expand. One of the writers has asked, I'm 30 years old and my mother is a helicopter mom. She calls my friends to tell them how sick I am when I'm dealing. She's very well intended, but she can be overbearing at times. Any assistance on how I can deal with my mom?
Yeah. You know, I would, I'm not sure who that person is, whoever you are. I would love if you'd reach out to me and I could help you with this. I've been there. It's a touchy subject. The best thing you can do is communicate. Have her watch this and see how we answered a lot of the questions. That might help give her insight. Yeah, that's a tricky one, but I would love to help you. I'm on all social media, so please find me. And I'm close to your age, but I've been there. The helicopter thing is really hard. It's a tricky situation, but it's really about communicating. That's unfortunately, but that is the answer. Yeah.
Shervin, where's your hand raised?
Yeah, I was gonna say, you literally got to look at mom and tell her, I got
Mhm.
this, both
Yeah.
literally and metaphorically. I got this, right? Take that initiative. If your mom is taking this initiative for you, you know how you do that. You undercut her. You take the initiative. You say, hey, mom, I just got back from a support group. Or, hey, mom, instead of getting sad, I researched, right? Do something proactive if you don't want her doing it for you. The best way is to lead by example. If you show your mom you're going to grab this thing by the reins and get ready, she won't need to lead you out, right? I think the best thing is for you to be proactive and maybe go to a support group meeting.
That's a good answer, Shervin.
Yeah. It's so hard when a mom, your child is sick and it's
Yeah.
all coming from a place of love. So it can be very tricky because some parents, if they hear that, they could take it the wrong way. Like, we don't know your mom. We don't know you. So we don't know what will trigger her, not in a bad way, but like, we're all different. And so I definitely think tread lightly, but be very sincere and just help her understand what it's like to be the one suffering, the one going through it. You know what I'm saying? So make
Wait,
sure
but
you
you
have
also have to kind of have to step into the shoes of they're a
Sure.
caregiver, they're
Exactly.
their parent watching their child
It's a
die.
lot of give and take.
You know what I mean? So she might be very scared because
Yes.
she's watching her child go through all this and feel helpless. You know, my dad's always said, like, if I could take this pain from you, I would. And it's very hard for him to watch
Mhm.
me have to go through all this because I'm his daughter.
Yeah.
So it's a tricky, but as long as you have open communication and maybe there's a little give and take.
Exactly.
Yeah, that was a very
We're
good
with
question.
you, though. We're with you. You're not
with you.
alone. This happens all the time.
That was a great question, Carrie.
Yeah, it's a great question.
Hi, this is
Thank you.
David. I have another question. What advice or tips do you have for bringing up scleroderma or working it into conversation with your friends?
Ooh, Fatima, do you want to touch on that?
Sure.
Okay.
Just thinking how to like. I think it depends on the people you're hanging out with. If it's like, suppose it's your like best friend and all, obviously you're comfortable with them and they love you. So I think that would be like an open conversation. But if it's like a friend or acquaintance or something like that, I would say just go with the flow. Like if the opportunity comes up, okay, fine, tell them out loud you have this condition, right? Suppose like they are planning a ski trip, right? You are not supposed to go on a ski trip. okay, then tell them, okay, fine, I have this condition and I'm not allowed to join you guys. So maybe next time. So I would say it depends on the relationship to have with the person. Like obviously, like not all of our friends are actually our friends. So we need to like actually like specifically see who is worth telling out to. And once we're comfortable with like with your own condition, I think you would be open to anyone who asks you this question in the end. Yeah.
I don't know
Right,
about you
I mean,
guys, but the question that sets me up for that is the lovely question, and what do you do for a living?
yeah.
I'm always like, awkward. And, right then, yep, what do you do? What do? I lie? No. I literally just say, yeah, I've actually been on disability for 10 years. I'm chronically sick. I have scleroderma. Have you ever heard of it? And then, I show them my skin. I have a great arm that's great for show and tell, and they can feel it. And once they feel it, it's like click. And the best way I describe scleroderma is I go to the Greek or Latin roots and do sclero means hard, derma skin, hard skin,
I mean,
vasculature.
also too, I think if it's a close friend or somebody that you're very connected with, ask them to go to a support group meeting with you and learn more about it. Like ask them to go on a Zoom call with you with your, if we're doing support meeting, like give them the website to go on and look at. Like, information is key to any kind of relationship. So I think the more they know about the disease, the less they'll be afraid to ask. So yeah, that was a good question. Go ahead, Fatima.
And I feel like the people who actually like see you for who you are, so disease or no disease, they will be there for you. So I think having a condition does not matter in the end.
Yes, for sure. Great question, David.
So the next question is geared towards Sherman. However, I think the other panelists can relate to this as well. I am a former hockey player too. Do you still skate or play hockey since your diagnosis?
Until COVID hit, I was actually doing what's called open stick time. I have these little green heat packs that I put in my gloves, and as soon as I'm off the ice, I got my regular gloves on. I'm not really playing like in a pro league or anything like that, but you don't have to give it up completely. You can still get out there for a little bit. You just have to be really, really mindful of keeping your hands warm, right? Or warm. If you're mindful, then you got the heat packs ready to go. I've gone snowboarding before, and I came back with less ulcers than I did when I wouldn't wear gloves. If you're mindful of what you're doing, you can pretty much do anything your heart desires. You just got to put your mind to it.
Right on.
For sure. Does anybody else still do something that they did that they loved before? Like I was a dancer, and I don't really dance that much anymore unless I'm like at weddings. I'm not like breaking it down in the street, but I like some things you just have to be, like Sherman said, really mindful of. But I do paint now. I've always been like creative and loved art, so I just find that if I take my brushes and make them bigger, it's easier for me to kind of make the movements. Yeah. So I know, Kat, you said you were really active when you were.
I was really active, and unfortunately, I can't do any of it anymore. And that has been truly one of the most heartbreaks for me for this disease. I was a pretty good volleyball player. I played, 24/7. I was a setter, which setter use those fingers, and yeah, and it's still like if my friends play volleyball, it hurts to this day. It's a little sting. And it just stinks, but unfortunately my body it's not worth the price I pay. But yeah, it's hard. There's nothing easy about losing who you used to be. And that's what's so important for people to realize is once you're diagnosed, things will change. That's that's inevitable. And that's so great. I love how Sherman and I know another friend of mine can snowboard. It's so extraordinary. Like I love that. I wish my body could do that. So I think it's really cool. I mean, I think it's important for you to find a passion, but yeah, not in all cases are you able
Right.
to make.
Right.
I gotta clarify. In terms of snowboarding, it was me tumbling down the little bunny hill for most.
It was you
I don't want.
becoming a human snowball.
Yeah, I'm not the next Shaun White. You will not see me at the Olympic Games. I just want to clarify that.
That was a good question, Carrie. I think we have time maybe for one more.
This is another question for Sherman. Maybe we'll have this one kind of answer it real specifically, because I think Carrie does have another question.
Okay, perfect.
So this question specifically for Sherman. Someone asks, I am currently getting my Master's of Science degree and plan to apply to medical school after this. How did you manage battling your pain, flare-ups, doctor's appointments, treatments, etc. during law school? And then with a follow-up of, do you fear that scleroderma holds you back from achieving your career goals?
So law school, I did part-time at night while I was working. So I took me a little bit longer. So I wasn't the 3 years of law school full-time. I dragged it out a little bit. So at night I was studying a lot, and that helped relieve some of the stress and pressures. In terms of the career, I've got to be quite, I've had so many battles over the thermostat at the office that this whole working from home thing has honestly been a blessing. Hate me, but COVID hasn't been the worst experience for my career, being able to work from home. It's hard. Like, you come to work, you got 20 voicemails. It's 85 degrees, but it's like 2 in the afternoon in July, and you get emails and you're stressed, right? So your hands are blue, you're cold, and you need to turn on, you don't need 60-degree AC blowing, but everyone else around you is sweating because it's 85 degrees out, right? So your body's reacting, and you're in an office, and my career has been, my career's changed. I look for places that offer remote work. I try, if I'm going to be in an office, I oftentimes try to be somewhere where I have my own private office so I can control the temperature, and be very, very candid with your grad school, right? Let them know if you need accommodations, if you need your own private room for testing. My first semester of law school, I never had accommodations at UCLA. I just kept moving forward, right? In law school, I had to look into that. You just have to after a certain point, right? Whether or not you want to accept it. If you have scleroderma, you're different. So my best advice is when you're in grad school, set up your accommodations, make sure you're in touch with the school, and you got your testing figured out. But if I can make it through law school, you can make it through any program, honestly. If I can make it through law school, anyone can make it through anything. I can make that a 100% statement.
That's awesome.
Seriously.
Thanks, Sherman.
Thank you.
I like that.
So we had a lot of comments coming into. First, I wanted to acknowledge a lot of people are typing in just how amazing you all are, and they're very grateful for your transparency in sharing your experiences regarding this disease. So the last question I have is, someone has stated they're just starting their journey of diagnosis. And is there anything that you could offer, things that you may know now that you may have done differently when you had first started your journey in diagnosis?
Yeah, I do at some point.
I think I would have spoken more when I got diagnosed. I would have not accept everything that people were telling me, because now I know that it was the wrong decisions. And I would have, like I said, defended my disease more and fight for it, because in the beginning of my diagnosis, I wasn't. I thought that everyone wanted to help me, and that was not the case. So if I would have done something different, was just stand up for myself more, like I do now, than I did when I got diagnosed.
Perfect. Sherman?
real quick, I was gonna say, if you've recently been diagnosed, just look at this panel and understand that medicine and technology has advanced exponentially since all of us were diagnosed, right? So when you start Googling, because you will, don't let everything scare you, right? Look at the dates on those pictures, look at the dates on the articles, and realize that we've come a long, long way, right? Seek knowledge, but don't seek sadness.
Perfect. Kat?
So I'm actually going to come at this with a different angle. When I was first diagnosed, the first person I ever met with scleroderma was about 3 months after I was diagnosed. His name was Corey. He was extraordinary. We became very close, but we were doing a rare treatment in the world's smallest town, Ida Grove, Iowa. And we ended up grabbing dinner by ourselves. And mind you, Corey was completely, basically paralyzed from the disease, basically a quad. So he couldn't feed himself, dress himself, nothing. He had skin, organ, I mean, you name it, he had it. So it was a pretty alarming person to meet with scleroderma at the beginning, but it was so good for me personally in my journey. And I asked him, I said, if there's one thing you could take back and do differently when you were diagnosed, what would it be? And he looked me straight in the eye. He said, I wish I wouldn't have worked. I wish I wouldn't have pretended I was well. And I wish I would have focused on my health. And I was like, got it, done, deal. Literally called my boss the next day. Haven't worked a day since. For me, that has been the best decision I've ever made because my disease is so ruled on by stress and especially working. So, I mean, we have to make sure everybody remembers too that every case is so different. And some can work, some can do this, and some can push, but some people cannot. And really, really make sure you try to get in tune with your own body and figure out what's best for you. Because at the end of the day, you're the one suffering what you're going through, right? And so it's really important that you live your own story. And as much as to get all of these great, advice and everything like that, in the end, it's got to be what's good for you.
Yeah. Anything you want to add, Fatima?
I would like totally agree with all of you guys because like the first thing you should do, like listen to your own body, just like hear what your body is saying. Do not push yourself.
Mm-hmm.
If you feel like not going out, just do not go out. That should be like your number one priority from now on. It's like,
Yep.
because when we do not listen to our bodies, we go into like a lot of stress, and then stress leads to flare up, and then it's like hell loses over, right? So like
Yep.
listen to your body, have a good doctor, have a good support system, and keep your mental health in check. Start doing meditations or journaling, have good friends around to keep you company and all. Netflix, like the binge watch shows and all, eat good food. Yeah, that's what you should do, trust me. And do not worry about tomorrow. Take one day as it is. Do not worry what tomorrow will bring to me. It's like just live in the present.
Well,
And do not Google search. Do not Google search because
absolutely.
creepy stuff comes out. Yes, creepy stuff comes out. And then you
Well,
get
and I feel like the green monster comes into play with scleroderma. We all, I mean, everybody compares
Oh, yeah.
anyways, but within the scleroderma community, people compare, well, this person with scleroderma does this. Well, this person with scleroderma can do this or can't do this. And that's a dangerous game to play because our bodies are so different. So just be mindful of that as well,
Perfect. That was a great question, Carrie.
Yeah.
If there's not any more questions, I'm just gonna say a few words in closing. You good?
Yes, go ahead. Thank you, Amy.
Okay, perfect. So first, I just want to thank everybody who came and joined the panel and listened and had questions. And so thank you all. I want to thank Angel and Carrie and David and everybody at the National Foundation who helped me put this together. I want to thank all of the panelists, Fatima, Sherman, Alejandra, Kat. I love you guys so much. I appreciate you so much. I hope this was amazing for you guys. And scleroderma is a hard word, and it's a hard disease, and living with it is even harder and more complicated. like we all said, our journeys are completely different, but we all have things that are similar and in common with one another. And especially being a young adult, there needs to be a platform or a safe space to showcase the beauty that is our lives and the difficulty that is scleroderma. So if you really enjoyed this and you'd like to see more of us, please, you can reach out to any of us. You can reach out to the foundation. Let us know how you feel. Let us know your comments. We'd love to do this again. You know, just because you're diagnosed, this isn't the end of your journey. It's
No.
only the beginning. It is completely only the beginning. And be mindful that you are not alone. We are here and we will help you through it. So thank you
Yes.
guys all so much. I appreciate all of you, and we will see you guys next time.
Love you guys.
Bye, guys.
Bye, guys.
Pleasure.
Thank you so much. Thank you so much for those wonderful words. In closing, again, I'd like to thank all our panelists, Amy, Kat, Fatima, Sherman, Alejandra. I'd also like to thank all of our attendees who logged in and dialed in today. I'd like to thank our Diamond and national sponsors, Actelion Pharmaceuticals US and Boehringer Ingelheim, and our corporate sponsor, Corbus Pharmaceuticals. As a reminder, we will be hosting these virtual webinars weekly, each Wednesday, so please stay tuned for our future webinars. And please stay connected with us through all of our social media platforms, as well as our chapter and virtual events that are also taking place across the country. This will conclude today's webinar. Please stay safe and be well. Thank you.
Bye, guys.
Bye,
Thank
everyone.
you.
Bye.
Bye.
Bye.